Good morning, Peter Goertz. I'm a psychiatrist. Can your mind affect your body? This is a fascinating concept to me, and it's a bigger issue in my opinion. So the question also then is, can something non-physical like a thought affect something physical like your body? So obviously your mind can affect your body. So if you're afraid, your heart can race. So that's one simple example. So it seems that thoughts and beliefs create chemical changes in your body. How that really happens, I don't understand. As far as I know, mechanics have been looked at, so you can look at levels of certain substances in the body if someone has certain experiences, like certain thoughts. But how the non-physical thought is actually transformed into a physical sign like heart rate, increased heart rate, I'm not sure that has really been elucidated, but it's a fascinating issue to me. So why this came up for me is this week I saw a patient with so-called non-epileptic seizures, and they used to be called pseudo-seizures. And this patient had actually been diagnosed with a seizure disorder and was on anti-epileptic medication. And in the emergency room, she had a seizure, and during that seizure, a nurse had put her hand on the patient, and the patient actually took the hand of the nurse off her during the seizure. So it was felt that the patient had a non-epileptic seizure. And when I spoke with this lady, she'd been under a lot of stress, had various psychosocial stressors recently, and also in the past, she'd had a history of major abuse, including really very significant physical abuse, sexual abuse, and with the physical abuse, serious head trauma as a child from abuse. So a very difficult childhood and stress in the recent past also. So it seemed again that this patient had non-epileptic seizures, but non-epileptic seizures do not exclude that the patient in addition had, at least potentially, epileptic seizures. So one doesn't exclude the other. So if someone has non-epileptic seizures, they can have potentially also epileptic seizures and vice versa. So it can be a tricky situation to elucidate. And that reminded me of another patient I'd seen in the past who had no seizure. She was about in her, I think, late 40s. The first patient, I think, was in her early 30s. So this patient in her late 40s. And she had no history of a seizure disorder, but had been under enormous stress and also had a history of abuse in the past, significant abuse. And she began in her late 40s having events, which turned out to be, as far as one could tell, non-epileptic seizures. So she did not receive long-term anti-epileptic medication treatment, and I saw her and prescribed an antidepressant, which also helped with anxiety, and we did some psychotherapy, and the episodes actually became very rare, and I'm trying to recall, but they may have even stopped. So with psychological work, looking at these episodes and just realizing that stress can contribute to physical issues like shaking episodes that in this patient seemed to be non-epileptic. So she was able to do quite well. And in general, there are certain things to look at if you want to try and differentiate epileptic seizures from non-epileptic seizures. For instance, if someone bites their tongue, urinates on themselves, defecates on themselves, that is more likely than a sign of an epileptic seizure if prolactin is elevated in the blood. That also points towards or makes it more likely that the patient had an epileptic seizure. And interestingly, stress can contribute to or can make epileptic seizures more likely, but also in a significant way appears to contribute to non-epileptic seizures. Thank you.